Good morning, everybody. Welcome to another Mancoll Minute at the end of another fantastic week here at Mancoll Plastic Surgery. Good question today came through, and I've actually had this a few times, is awake lipo versus having to go to sleep for lipo. And there's lots of different kind of lipo techniques. I have smart lipo, which is a laser liposuction, which was marketed initially, and I haven't really seen them market much in recent years, but the idea was you could put tumescent solution in, you can be completely awake, you can find these YouTube videos of women giggling and laughing, and it all seems awesome. And I guess for isolated areas of fat, it's very doable. But in my hands, as a plastic surgeon, as a board certified plastic surgeon, as someone who has done, reconstructions from the biggest traumas and cancers all over the body you can think of, to the biggest cosmetic surgeries that we do with mommy makeovers and so on, my comfort level will always be you being the safest possible and the most comfortable. Stress is a very bad thing. And when you kind of don't look at the edited videos and you talk to anybody that has an office next to someone doing some of these awake lipo cases, and they talk about the screams and the people yelling, it's not that comfortable. We can talk about, all right, you can have oral sedation, and I can give you a little bit of Valium or a little bit of pain medicine, but I can tell you, especially with the energy-based type of lipo machines, that's either Vaser or Smart Lipo, and even the Renuvion, as you get around the ribs, it is never as comfortable as I want it to be. And I can promise you as a surgeon, if you're not comfortable, I'm not going to be comfortable, and I'm not going to do my best job. I can be way more aggressive for you in contouring and shaping and sculpting when I know you're safe, because I have an anesthesiologist controlling your medicines, which then controls your blood pressure, your heart rate, your saturation, all the things that it takes to stay healthy and safe. Because listen, as awesome as my cosmetic world is, it is only as good as it is safe. So I do worry that when I'm doing things with oral sedation, am I going to cross a line on someone? Because it doesn't matter how healthy someone appears, you just don't know till you start getting medicines and how they'll react. So there's a risk factor there that at this stage in my career, I'm just not willing to take for patients. I want safety beyond everything else. I want comfort beyond everything else so I can do my best job. Because I promise you, from my perspective, nobody comes back in 6 months unhappy and remembers that I had to limit how much lipo I did because they were too uncomfortable. They're looking at me going, why didn't you make this better? So for both of us to get the best results out of this, I feel pretty strongly the patients should be comfortable, and very strongly they should be safe, and that generally means higher sedation than can be achieved with tumescent only. And if that's all your choices are, and there are people out there doing liposuction that are not board certified plastic surgeons, they may call themselves cosmetic surgeons, and they could have come from the ER world or family practice or any other honorable medical profession, but are not board certified, they're unlikely to have an anesthesiologist working with them to do what I have the luxury of here in my practice. So for all the different kind of non-going to sleep liposuction or body contouring options out there, my worries, my comfort, really are about how to keep you safe and comfortable while I'm able to do my job effectively. And I also know when I do things under local and I do things with oral sedation, which I do at times, it takes me a lot longer. So that always factors into cost. And I think when it comes down to it, for all the fears that people have about anesthesia, I think it's more about the cost of anesthesia than it is necessarily a fear. Because when I really ask people, and I go, what are you really worried about with anesthesia? Generally, the stories they tell me, the worries they give me, are kind of the Hollywood version of what anesthesia is. Because, when you're watching a movie and people are in the operating room, or you're watching TV, it's very exciting. I mean, everybody's running around. It's life and death all times. But that's not the reality of the OR, because we're trying to create the most controlled environment we can. So after I get to talk to people about what anesthesia really is, then generally that fear melts away pretty quickly. So misconceptions can really take us down a bad trail. Hopefully that's helpful for folks who are trying to decide. I just don't think that saving a few dollars is worth the safety potential and ultimately the comfort, which is part of the whole process. And then in the end of it, when it's all said and done, I think does compromise the outcome. So if there are any questions about it, come on in. Love to talk to you about it. Love to explain that a little bit further. And otherwise, have a great weekend.